Welcome to Floorstocks. I am Kenny Polcari, and I am coming to you live today from the Nasdaq market site in the heart of Times Square in New York City. Today I'm sitting down with someone making waves in the future of medicine. Brian Norton is the CEO of Wellgistics Health, a publicly traded Nasdaq company, symbol WGRX, that is fixing how prescription drugs move through the U.S. healthcare system. At its core, Wellgistics helps medicine get from manufacturers to patients in a faster, cheaper way and without all the middlemen who jack up prices and slow things down. They are at the forefront of regenerative health and biotech innovation. They are doing the kind of work that could redefine the way we recover, repair, and reimagine patient care. Brian has spent his career building companies that solve real problems in healthcare. With Wellgistics, he's helping independent pharmacies survive, he's giving employers a better way to cover prescriptions, and he's using smart technology and AI platforms to cut waste and deliver better outcomes for everyone, patients, providers, and investors. Brian's background spans nearly every corner of the healthcare ecosystem. Whether in business, sport, or life, his approach is the same: full throttle, mission-driven, and built to last. Now, this is more than just stock talk. This is about the mission, the impact, and about what investors really need to understand. Ladies and gentlemen, join me in welcoming Brian Norton to the conversation. Brian, it is a pleasure to meet you. Thank you very much.
Thank you.
You are absolutely a
introduction.
triathlete. Look, before we really talk numbers, let's just take us back a little bit and tell us how you stepped into the space and what problems you're trying to solve, and tell us how bad it was.
Yeah, so I got into wholesale distribution about 12 years ago, so now about a dozen years in serving independent community pharmacies across all 50 states. That was my objective. I had left the call center business, sold that off, and got into assisting pharmacies. I saw a real need, and really when we look at the independent pharmacy, we realize that they're pretty much the last case resort in many cases for providing services to communities. And so my focus became, how can I help the independent? And as I did that, we had a lot of success in sourcing drugs for them, finding opportunities for them to make a little bit better margins. And the thousands of pharmacies that we were helping, we did about $500 million in sales in our first 5 years in business. So we did really well in distribution. But we started to really see a pain point in the pharmacy space, and then that bled into the other service providers as well. And so with pharmacies, we realized that they were really getting, in a lot of ways, screwed. They were getting hosed by big, convoluted, difficult contracts from their PBMs, the middlemen, who they get reimbursed by, just filled with opaqueness, a lot of anti-competitive nature where the PBM would steer patients away from their hometown pharmacy to their own pharmacies, and just a lot of problems in how they operate with their sourcing of drugs as well. So the big three wholesalers. And those
So who are they? Who are the three big wholesalers?
If we go to the big three wholesalers, about $750 billion annually, you have McKesson, Cardinal, and formerly AmerisourceBergen, but Cencora. Right?
Okay.
Three massive wholesalers control about 85% of the market. Of the movement of the drug. Then you go over here to this side and you have the big three PBMs who are owned by three insurance companies.
Right, of course they are.
So you have CVS Health, who owns Caremark PBM.
Right.
You have United Healthcare, who owns Optum PBM.
Right.
And you have Cigna, who owns Express Scripts PBM. And I think most of America knows these three companies because when you pull out your insurance card, you see either Optum, Express Scripts,
right, or
Caremark on your card when you go to the pharmacy.
Right.
Right. So those six dominating companies control about 80 to 90% of the prescription market. And in that control, just like anything, you have a bit of a monopoly or even an oligopoly that starts to take place where, because they have so much power, they can kind of do whatever they want to do in the marketplace. They reign free, reign supreme, and they're all about themselves. Right. And so that pushes, there's four major stakeholders out, okay? And this is where we really step in because we saw the pain point in the markets with four major stakeholders. You have your drug makers. Actually, it's not Big Pharma, the bad guy.
Right.
Drug makers actually have a lot of pain points because of those six.
Right.
You also have the providers, which are your doctors, right? You have the pharmacy, and then you have the employers, right? The companies that are offering the insurance.
Right.
In almost every case, they're self-pay or self-insured or self-funded employer groups that are footing the bill for the cost of these prescription drugs. So when those costs are really, really high, they have to foot that bill. And so the employer groups are really suffering. So we started to see all of these major problems in the marketplace and set out to solve all those problems.
Right.
And I'll talk about that with you and how we do that.
Well, because I think that's actually, that's really the core of what we're going to talk about, because I think that's, for most Americans, that's kind of where the pain point is, right?
Yeah.
So talk about then. Let's talk first of all your biotech innovation, right? And what that entails in terms of where that plays in Wellgistics.
For us, when you look at really it comes down to the drug maker, right? And so if a drug maker comes out with a unbelievable brand name drug, let's say, and it can be the world's greatest drug, life-saving medicine,
Yep.
but if it doesn't make it through the supply chain appropriately, it doesn't matter.
Right.
So what we really focus on is we have to help the drug maker get it through commercialization and all the way to the patient.
Right.
Turns out that whole process
Yep.
is very, very messy. It's
Right.
very, very problematic in the marketplace. So when you think of Wellgistics, think of these guys are maker to taker. They're
Right.
the movement of the drug all the way through. So we are an enhanced specialty supply chain company. And we work through our technology platforms, we work to ensure that prescription drug that's written by the doctor is managed properly, routed properly, goes through the proper services for dispensing with the pharmacy, and makes that way back to the manufacturer in the data of it. So we can actually enhance from what the manufacturer is now sending off their dock
Right.
to when it lands at the patient's doorstep, and we can show the entire movement all the way through.
But are you doing it without the PBMs?
Correct.
Okay, so then walk me through that. Here I am, I need Losartan or some other drug. I go to CVS, Caremark, right? And I go to pick up my Losartan. So tell me how this is going to impact me.
Yeah. So we are in the phase right now where, because this is novel, because the market is new to a lot of this, and a lot of the drug makers are just now starting to see that there is a route away from the legacy PBMs, it's carve-out based right now. So we can't just take any basic drug. And what I would say to an average drug that's either generic or coming off a brand is that we also have a platform that we'll show you, and I'll talk about in a second, where you can just go on, do like a Priceline or an Expedia shopping tool to see what your cheapest cash pay price is.
Right.
And you can see absolute rock bottom pricing, like you would be going to Canada or Mexico for your pricing.
Right.
That's actually available in the US, and people don't even realize it.
Right.
So because discount companies all come together and compete, you get the lowest price, and it's a great tool. But when you go and slap your insurance card down, it's a little bit different,
Right.
Because now you're going through the insurance conglomerate system, and you're going through all of their
Right.
models, right, that kind of force you through paying more money than you probably need to pay.
Right.
So set that aside from carve-out platforms. So what we do differently is we go on both the product side for distribution, which we own our own distribution center, all 50 states, FDA, cutting edge, state-of-the-art distribution center out of Tampa.
Where are you getting your drugs from?
So we buy them from the manufacturers.
Okay, direct from the
Direct from the
manufacturer.
manufacturers. We have about a little over 200 direct manufacturer contracts.
Okay.
Right, so we get drugs, but more importantly, what we do is we do the coupling of services for patients and employer groups with the product now. So this is novel, this is new in the marketplace, in that when you assist an employer group with helping their members with managed care programs, it really becomes a full suite of services from end to end, in that we can take that management of that program and we work all the way through back to the manufacturer to get the drug, okay? And so I'll explain it a little bit differently. What we ultimately do is we package a particular disease state. Think diabetes,
Right.
think migraines, think dermatology, think sleep help, pain management. We take these categories and we have multiple, hundreds of thousands of members inside of our employer groups that we peel out these very particular drugs that are very expensive
Right.
or difficult to manage those patients. And we take that particular group, combined amongst all the employer groups and all the TPAs we work with. And then we take all of that base and we take it to the manufacturer and say, hey, look what we've got. We've got not just a couple, but we have thousands of patients we're going to help you with your drug delivery to. And we're going to fully service them, fully managed care programs, all the technology in place to route the drug properly from the physician. And then we work with the pharmacy to help deliver and dispense the drug. So this is where it's unique, okay? In that, think of Uber or Lyft, right? How is Uber the largest taxi fleet but doesn't own a car, right? We're the largest pharmacy fleet but don't own a pharmacy. And the way we do that is that we route the prescription of that patient care program. We route those prescriptions to the community pharmacies in that particular area of the patient. The pharmacy then becomes the Uber or the dispensing pharmacy for us. So they service that patient locally, which we love. We want them to service that patient.
Okay, so then I would imagine big companies have to love this idea. Right?
Yeah, they absolutely do. Just to give you some perspective, in the past 6 weeks, we've had 65 meetings with direct manufacturers about this program, and they absolutely love us. They are all in on how to do this. Now, they're a little slow, they're a little old, I mean, they're
like
old
anything,
school, right? So they take time, but as they see this new way, they're very, very interested. We can increase market share for them on singled out prescriptions that they really want to see move through the system that are large, big box brands in many cases, but they want the full suite. They want to know that it's leaving their doc and it doesn't disappear. And that's the case today. The minute it's gone, it's gone. They don't know anything about that drug or how it's moving in the market or how it's servicing the patient. They don't know anything. They're blind. So we provide everything from A to Z, and then we streamline all that data back up to them and we show them. Here's the managed care program. Here's how the outcomes are looking. Here's what their access looks like. Here's what their patient base is doing. And we can provide that data back upstream to them. In that process, we have to control every step of the way, right? So if we lose control and we have to farm out a distribution to McKesson,
you lose the
gone.
data.
The whole thing goes away.
Right.
If we don't have our own ability to control that patient and route that prescription drug, we lose the control. So in what we've built is a fully integrated end-to-end maker-to-taker ecosystem in prescription drugs.
Right, so but you're challenging then the whole PBM model, am I right?
Yeah, very much.
Completely challenging the PBM model.
Yeah, and I'll disclaimer that not all PBMs are bad. Right. The three big ones.
I'm not suggesting they're bad. I'm just saying you're challenging that model.
We're challenging, and we do actually work with a lot of boutique specialty PBMs that might manage 500,000 to 1 million lives, and they are doing good things. So they call themselves transparent PBMs. It's like the new thing coming. Watch for it because you'll see it coming. And they're raising a lot.
Do we know who they are? They publicly traded, or we don't know them yet?
I don't think any of that I know of are publicly traded. There might be a few, but there's a new one that just came out. I'll just throw them out as a reference point because I think they're actually doing really great things. A group called Lucy RX, Lucy, like a girl named
Lucy.
Lucy RX. They just raised $500 million. And they have about 1 million patients now, and they're doing really good things. Their leadership team is phenomenal. And so you take someone like them and you say, okay, how can we help them? So what they do is they're just trying to manage better outcomes for employer groups to get better pricing. So we can step in and offer, our platform services all. We can offer the prescription routing. We can offer the full managed care program for particular disease states like diabetes. We can help them. So we don't exclude them, but what we do say is that at a manufacturer level, a drug maker, the pain point for a drug maker is they have to pay rebates. Okay, this is a real market confusion.
I never really understood that. Like why that happens.
They have to inflate their price so they can pay a fake rebate that the PBM pockets. So this is the grand fallacy is that, most people don't really understand even what a PBM is. A prescription benefit manager was supposed to step in and help deliver better outcomes for the employer group to get better pricing and negotiate better rates. In that process, they got so big that they said, well, let's kind of skim here and let's take a lot of this back and keep it ourselves and not share it back to the employer group. So this is called spread pricing. What they do is they charge that particular list price to the employer group. Let's say it's $1,000, but then they go and reimburse the pharmacy because they're the ones, that they reimburse through.
Right.
It has to go through the pharmacy. So they reimburse the pharmacy at a much lower price. So they spread that spread, they keep the difference.
Right.
Right. But in the rebate program, if I come to market with a brand name drug, I have to pay to play to get it to have access on what's called formulary, which means it's just getting covered. If you show up with your card and sorry, you're not covered, well, it's because the PBM chose not to cover it.
Right.
Why? They chose not to cover it because they didn't get a big enough rebate.
Right.
Or what we kind of call kickback.
Right.
Right?
Right.
Okay?
Yeah. Rebate sounds better.
Yeah. So, yeah, it does. Sounds a lot better, right? So it's very convoluted and confusing and complex, and they keep it that way on purpose.
Right. Of course they do.
Legacy systems inside of pharma right now that control 80 to 90% of the market very much depend on obscurity.
Right.
And we come out and defy all of that.
Right.
Our entire business model says we're going to bring it all out into the light. We're going to show the manufacturer that they can route all these prescription drugs direct to the patient, still use the provider access, have all the technology in place, but we're going to be transparent with the data. We're going to show you everything, including the employer groups. You get to see it all, and we save everybody money.
So is that going to save me, the end user? Is that going to save me money on the drugs that I need?
Yeah, it's going to save you money, and it's going to do away with or rid yourself of the delays and the denials and the deferments and all of the problems. So it may not be you necessarily, but just about everybody in America has a parent, a grandparent, an in-law, or a friend that is suffering in some way or another with the healthcare system.
Right.
It's not going well for most Americans.
Right.
We kind of have a sick care system, not a healthcare system.
That's right.
And so much of that has to do with these antiquated, broken, old school systems that have not found their way out yet because nobody has innovated.
Right.
And we have stepped in the past 2 years, we really saw this incredible opportunity to innovate in a broken space. And so when every stakeholder in the supply chain is suffering, it's huge opportunity for us right now.
Right. So tell me something. How long is Wellgistics? How long have you been in business?
So Wellgistics was the company that I acquired from a PBM actually called Welldyne.
Was not
back in
publicly traded, or was
no,
it was not?
No, they were selling to a private equity at the time.
Okay.
So they carved out their distribution because it wasn't very profitable, and they had a beautiful facility, and I kind of got locked in on it and said, can I buy that from you? And so back in 2017, I was a couple of years prior just brokering and helping consulting pharmacies, but then I realized distribution was the real way to go and having my own distribution center. So I got into that in 2017. And then 2 years ago, this whole ecosystem, vertical integration, owning every step of the process to help the patient became really my laser beam focus.
Right.
I really wanted to see this through because I knew that there was a huge opportunity in the marketplace. And most people don't know about it.
Right.
It's still happening.
Right.
And
Right.
so through a number of acquisitions, we pulled in pharmacy ownership and we pulled in tech and hub services, right? So you have to have those in place to service with the product together. So we built that, and then from that roll-up, decided to go public.
Okay.
And we went public end of February.
Here on the Nasdaq, and just 3 months ago.
Yeah. So we're newly minted
Congratulations.
public Nasdaq company.
Right.
So, yeah.
Let me ask you a question then. So how do you, or how is this going to impact large employers when they're talking about healthcare? I mean, in terms of drugs, because prescription drugs are a big part of the system. 100%. How is this going to impact them? And every November when they start talking about next year's healthcare and all that stuff, talk to me. Where's that door for you? Where's that window for you?
Yep. So employer groups see an average of a 15% increase in their prices annually.
Every year.
Ask the question.
Right.
How does an employer group pay 15% more, see worse coverage?
Right.
Right? Because remember, they're setting up plans for their employees in the plant. You go in, and if you're part of an employer group, you're choosing, do I want this deductible or this deductible? And I pay less and less out of my check to do that.
Right.
So there is an employee contribution, and the employees are getting more and more disgruntled to the point where employers are saying, look, I'm just going to give you $500 a month or $1,000 a month. go buy your own insurance.
Right.
That's really what's happening on a massive scale right now. And so what we do, and most of your large volume will come from the brokers or the TPAs that get in the middle of large TPAs with millions of lives. They service many of the employer groups, right? So they bring the insurance packaging and they deliver the whole thing and they set up the plans. So we work with them.
So 1 second, just define what a TPA is for everyone.
A third-party administrator.
Third-party administrator.
A third-party administrator will step in and essentially broker an employer group coverage. Okay, I'm offering your company with 500 employees this package or this package. Which one do you want? We'll set it all up. So they help administrate to these large boxes of many employer groups, right? Some are small, some are really big. I mean, there's some TPAs that have 10 million lives they manage, and some that are 1 million and some that are 200,000, right? So we work with all of them because that's the faster route to the employer groups. And in that, we work with them on carve-out models. Okay, this is the starting point. There will be phase 2 and 3 that will come from this, but in the carve-out space, we just want to say, hey, let's take your obesity members, just them, okay, or let's take your diabetics, or let's take your people with a certain type of dermatological issue, right, skin problem. And we work with specific programs within those managed care platforms, and we bring that specific drug to that patient. And because we do it in that way, we're able to negotiate significant discounts with the manufacturer. So how they avoid having to pay the big rebates and all those things is we just go to the manufacturer and say, hey, net of rebate, just sell us your best price that you're okay with, because you don't have to pay that rebate.
That's right.
Then we go back through and we work with the actual employer group and those TPAs to negotiate a particular price, and they're already footing the bill. They essentially foot that bill. So it's an employer contribution with potentially an employee out of pocket as well. We create our own card that's specific to us, branded to us in a way that it connects that price and that product to that patient, and everybody syncs up together. So this whole thing has this beautiful synchronization where now you can get a particular drug that was maybe costing you and your employer group a lot of money, maybe even as high as $10,000 per month on really high-end brands. And we may be able to negotiate that and get that down by as much as 50%.
Are you able to access every drug across the spectrum, or not yet?
I want to say yes and no. So we have had the conversations with just about any drug with the manufacturers in almost every category there is. It's just a question of whether or not it all makes sense inside of that ecosystem, right? So everybody has to participate. And as they do, and as they open up their eyes to, wow, this is really impressive, how much everybody can save in the system. Because think about it, out of every dollar, I'll explain this, out of every dollar, about 40% of it goes to the drug maker, roughly. The other 60% of that dollar is hitting those two big legacies, right? The PBMs and the wholesalers. So when you get rid of that, you have 60%. So in that 60% is where we make our money, and we share back that 60%. Multiply that times billions of dollars in the system. There's a huge opportunity right now, a gap, a loophole, a gap in the system that says, if we don't have to deal with the 60% bloat, garbage, it doesn't provide any services back to the marketplace, really. It doesn't do much. You know, the PBMs don't really do anything.
Okay, but help me out here for a second, because I would imagine the PBMs are looking to put you out of business. They don't want you in their space.
They're so big.
Well, I hear you.
I think if, obviously as we get bigger or as we grow, I don't think they're going to be around doing what they're doing much longer. So if you really see what's happening on the Hill, from legislation alone, we're seeing massive trends. And I think this is what investors should really also think about and look into, is what's really happening with PBM reform, and take a look, just see what's happening. Everybody's opening their eyes to these middlemen and what they're doing. Most people didn't know, it's catching on. And so with that, a lot of, AGs across, I think about 20 AGs are now all stepping in to fight against these big
PBMs.
PBM problems.
Yeah.
I mean, they really do create a lot of issues inside of the marketplace because they control whether or not you get a drug or not.
Right.
Not your doctor.
No, right.
But them.
Right, that's right.
Right.
Let me ask you another question, just because I'm curious about this. When you say you're talking to the manufacturers, don't we manufacture most of our drugs outside of the country?
Yeah, I mean, I say CMO, so contract manufacturing does happen a lot outside of the country, but some of our biggest manufacturers are right here in our country.
They are.
And some of the biggest innovation in drug happens here in the U.S.
Right. The R&D happens here for sure.
Correct.
For sure. But you're hearing all these stories about China making our drugs and India making our drugs, which I think is a national security problem. That's a whole nother conversation. So I'm curious, when you say you're having these conversations with the manufacturers, you're having them here in the country.
In the U.S., yeah. And even if they're headquartered outside of the U.S., take like a Novo Nordisk, right, who's headquartered in Denmark, right. Their presence here in the U.S. is still unbelievably strong, right? Most of their money is made in the U.S. market,
right?
Okay. Right. Now, where Trump came in with his favored nations clause, that was an executive order about about 45 days ago or something. Yep. Is his whole push is to say, why are we paying such high prices when you can go to Canada or other countries and get such a low price?
100%.
So we're subsidizing these drugs for other countries by paying a huge premium on them, sometimes as much as 5 times more.
Right, but they argue that point, saying that we're the ones doing all the research and development.
Yeah, well, I agree. We are the ones doing the research and development, so we should get the benefit and the discount, not pay the premium. Why are we paying 4 times more if we're doing the work?
I'm with you 100%.
Right? And I think with that favored nations clause, how it rolls out, it's still kind of to be determined. But it is putting pressure on opening up the visibility into really the true problem. It's that if you get rid of the PBM rebate program, it changes everything. I think a lot of the reason that our drugs are so expensive in the US is because you have so much bloat in an unnecessary system that if you get rid of that, everything changes.
Right. Oh, I think you're 100% right. 100% right. Listen, in these final thoughts, is there one thing that you want the investor, right? Someone who's out there, right, that can buy WGRX in the marketplace. If there's one thing you want them to take away from this interview, if you had, 30 seconds on a cable business program, what is it that you would tell them about Wellgistics, about you, about the future, about what's exciting and what's happening at Wellgistics?
The traditional old school legacy system is broken. We fix that system. We provide a fully integrated end-to-end ecosystem prescription drug platform that services all the major players that deliver you the best possible drug to your doorstep. We can do that now in a way that's unobstructed, that's not confusing, that creates a lot of opportunity in the marketplace for investors right now to take a look and see that we really do solve a massive problem. We're not just making a widget. We're not just, something that we do really well. We're solving a national crisis right now with prescription drugs in America. It is truly a crisis. 1/3 of Americans walk out of their pharmacy without a prescription drug that their doctor wrote. 1/3, over 30%.
Right, and they do that. And they do that. Why? If the doctor wrote the prescription, why do they walk out without that drug?
Because their insurance doesn't cover it.
Won't cover it.
Right? So there's a way to fix this problem. Right. We need to make sure that patients get their coverage. If you don't get the prescription your doctor wrote you, what does that mean? What does it mean for hospitalizations down the road, for future problems, for potential death?
Right.
I mean, we're talking about life-saving opportunities here, and we've really seen an impact through our platform. Like if investors take a look, they're going to see that we're transitioning away from specialty wholesale distribution and really into a full ecosystem, vertically integrated, end-to-end platform. We're executing on massive contracts right now. We're working through our technology AI platforms that are streamlining and cleaning up cost, helping with more efficiency to route the prescription drug from the manufacturers and the prescribers to the patient, right? And so in that process, we essentially clean up the mess. We
Right.
clean up the system.
Right.
We fix the broken parts of the system, and we let every single stakeholder in the process win. The pharmacy now gets to win because they don't have to deal with all the problems that they deal with PBMs and with the big three.
Right.
The providers love us because they can route their prescriptions straight through us, and we can help them find the best pharmacy for their patients.
Right.
So they're happy. The doctors like us.
Right.
The drug makers love us because we can do away with all the problems they deal with and all the costs they have to pay for going through the traditional system.
Right, and the patient's going to love you because they're going to get access to the drugs that they can get that their insurance is not going to provide, or is not going to.
Yeah, and we'll manage your entire care program. So our managed care services are elite. They're VIP concierge level, right? Everything that patient could need from fully managed care services. So if somebody's diabetic, we will service them with all their diabetic products.
Right.
But we'll also follow up with them on patient monitoring. We'll work with them on any issues they might have with delivery of their drug or getting access to their drug.
Right.
We're just very hands-on with patients.
So is all this monitoring happening here in the United States?
Mm-hmm. Yeah, our headquarters are based out of Tampa, Florida.
Right. So all these people are here. Yeah, I'm not going to pick up the
US
phone
based.
and call somebody
100%.
on the other side of the world that doesn't know who I am and doesn't understand what I'm saying. They're going to get it.
No, we don't have offshore call centers, none of that.
I think that's tremendous. I think not offshore call centers is tremendous, especially in healthcare.
Yeah, 100%. And what we're also seeing is the innovation of AI is just really game changing.
Right.
And that there's so much old school waste. I mean, you're talking fax machines and phone calls and all this old system stuff that AI is completely fixing right now in automation. So the stuff that doesn't really touch the patient but happens behind the scenes, we're totally automating all of that from prior authorization platforms. It's incredible. Doctors spend about 15 hours a week doing just prior authorizations.
Right. Right.
A doctor.
Right. Waste of time.
You're a medically licensed MD,
Right.
and you're spending 15 hours a week doing shuffle work,
Paperwork,
right?
right.
And so that all has to go away, and we're fixing all of that. We're cleaning all of that up. It's the waste in the system. It's everywhere.
Right.
And as we look at all the different stakeholders, we're blown away that there's just ripe opportunities everywhere.
Is there a competitor in your space that you can identify or that people may know, whether they're publicly traded or not?
It's really interesting. I've been asked this a lot, and we've been looking to try and find one because we want to see how we compare.
Right.
And we really can't find anybody that's doing it the way that we're doing it.
Right.
And I don't say that just to say it. I say it because I genuinely cannot find. I think there are others. I've heard a lot of word that, a lot of grumblings that some of the big box guys are starting to catch on and do it too.
Right.
But they're leaving their McKessons or their Syncoras to go form their own company to do this.
Right.
And what I mentioned about that PBM, you will start to see, the market will start to see that a lot of PBM specialty transparency work is coming because it's so big at the highest levels and it's so broken and there's so much reform coming that everybody's jumping in front of it saying, let's get a better model.
Right.
Because this one's going to break.
Right.
It's at the verge. I mean, we are at a massive junction breaking point right now, crossroads, with these PBMs all falling because of PBM reform.
Right.
Because actual legislation is taking place.
Right. There'll be legislation reform.
It's coming. It's happening. It's inevitable. You cannot. It's the word's out. Right. The gig's up.
Right.
And so because of that, all this new business is going to emerge in doing it a better way. So as we do this, we are not a PBM, but what we do is almost all of the work behind. We are entrenched in the behind the scenes systems that the PBMs actually need.
Right.
So we can contract, and we will be contracting with many of these specialty PBMs, the ones we like and that are doing it right, to be able to provide services and drugs, actual distribution to them.
And that's still going to end up bringing costs down.
Absolutely. Yeah, because they're saying we will share in the savings to the employer group. Right. So if we can provide them the savings, they share those savings back to the employer group.
Right.
Our profits are made in the distribution of the drug to those patients and in providing services. So we can charge for our services on a PEPM or a per employee per month basis. Right. So recurring revenue happens on our SaaS fees our service fees that we charge, and on our and we get to also make money on the product we sell.
Right.
Most of our revenue comes from our product sales, but we package the services in all, think of it for free,
right,
with this base price.
Right.
So we sell it at a flat rate price, but we'll build in all the services, and they love it.
Right.
Right.
Perfect.
So the PBMs love it, the manufacturers love it because they don't have to worry. And then by doing something very different that, again, is not done in the marketplace, which is the transparency and the data. When I share the data back to the boutique PBMs, the employer groups, and the manufacturers, everybody is winning because they get to see exactly what's happening with their drug going out the door.
Right.
Today's current system, they're all blind.
Right.
They don't see anything. Employer groups have no idea why their price goes up.
Right.
And manufacturers have no idea what happens to their drug once it leaves.
Right.
So when we bring that back to them, they are absolutely elated to have that.
So this sounds like a great story, and I'm glad you and I had this opportunity to talk. I want to revisit this with you again, whether it's 6 months or 8 months down the line, because I'm very curious on where this story is going to go. And how. Listen, if investors are interested, Wellgistics, WGRX is the symbol, trades on Nasdaq. You can buy it there. You can certainly watch this interview, and if you need more information, pay attention because we'll be talking more about it. Thank you for joining us.